Welcome to Module 3 of the e-learning course on a public health approach to addressing female genital mutilation. Module 3 is on the management of FGM-related complications, and it is derived from the WHO's clinical handbook for the care of women and girls living with FGM. This first session is on FGM-related immediate and short-term complications. The short-term and immediate health complications resulting from FGM include severe pain and injury to tissue, hemorrhage and hemorrhagic shock, infection and septicemia, genital tissue swelling, as well as acute urine retention. At the end of this session, it is expected that you as the participants will be able to recognize the scope of immediate and short-term health complications arising from FGM, as well as manage girls and women who have suffered these immediate and short-term health complications. It's important to note that most patients who present with immediate and short-term health complications arising from FGM must be treated or referred without delay, especially those with life-threatening conditions such as severe hemorrhage, hemorrhagic shock, and/or septicemia. Just like for many other medical conditions, the first step in assessing for immediate and short-term health complications of FGM involves taking a history. While taking a history, you introduce yourself, the patient, and her family members. You ask them about their presenting complaint, gaining as much information as possible, and if you suspect that the patient's health condition is due to FGM, you ask her tactfully about any procedures she may have had, including FGM, and use terminology that is familiar with her. You will also ask her or her accompanying family members if she or they would like to share any information about her health condition and any problems that she may have had related to FGM. Like we learned in the last module, you reassure her that you are comfortable dealing with her condition and that her FGM status is not a barrier and will not prevent her from accessing health services. You will also let the girl or woman express her feelings and give you the information she wants to share. And if she starts crying, you will be patient and give her support. Finally, while taking a history, just like we learned in the last module on person-centered communication, you will listen carefully and show empathy and concern. You will let the woman or girl know that you can help her. It's important to note that once it has been established that the girl or woman has undergone any type of FGM, this information and the subsequent clinical examination should be handled with professionalism and discretion. Any information obtained during history taking, including the type of FGM and complications, should be recorded as required by the policy of the healthcare institution that you work in. The next step in assessment for immediate and short-term health complications of FGM involves performing a physical examination. Like for any other medical condition, you will ensure privacy and confidentiality. If the patient is alert, you will explain to them that you will examine her and that this will involve a genital examination. And if she's unconscious and a family member is present, you will explain to the family member what you're about to do. Important to note that consent from the husband or partner may sometimes be necessary before conducting a genital exam on a woman. In the case of minors, you must first obtain consent from parents or legal guardians. You will then ask the woman to lie on her back with her legs apart and knees bent, and then expose and inspect the external genitalia, making sure to cover the patient until you're ready to examine her. After completing the examination, you will thank the girl or woman for cooperation, help her to a sitting position, and share your findings with them. For minors, you may share your findings with the parents or legal guardians. Finally, you will record your findings accordingly. We will now move into the management of specific immediate or short-term health complications related to FGM. And the first one is severe pain and injury to tissue. Severe pain and injury to tissue associated with FGM is managed in the same way as pain and tissue injury caused by any trauma is managed. First, you assess the severity of the pain or injury, and if an IV line is available, you secure venous access, and then you give strong analgesics, if possible intravenously, and treat the injury. In case of an open wound, you will clean the site with antiseptic and advise the patient or her attendants to keep it clean and dry. And if the patient is showing symptoms of hemorrhagic shock, you will treat appropriately, as we will discuss later. A point on referral: if there is no relief from pain, you will refer the patient to the next level of care, as well as if there is extensive injury to the tissue, the patient will be referred for surgical repair of any injuries. The next short-term and immediate health complication related to FGM is hemorrhage. Hemorrhage is the most common and life-threatening complication of FGM, and it usually results from cutting of the clitoral artery, which contains blood flowing under high pressure. Severe bleeding associated with excision of the clitoral artery is managed in the same way as severe bleeding resulting from other circumstances. First, you assess the seriousness of the bleeding and the condition of the girl or woman by checking and recording her vital signs. Next, if the bleeding is serious and an IV line is available, you secure venous access. And then you inspect the site of the bleeding, clean and apply pressure at the site so as to stop bleeding by packing with a sterile gauze pad. If the bleeding is not serious, you'll advise the patient and or the attendants to keep the site clean and dry. If the woman or girl is suffering from hemorrhagic shock, you will treat appropriately, as we'll discuss later, and if necessary, replace lost fluids. In case of cultural practices like putting ash, herbs, soil, or cow dung to the wound, you will give tetanus toxoid and antibiotics. The next immediate or short-term health complication of FGM is hemorrhagic shock. And this usually occurs when there is reduced volume of blood circulating in the body as a result of severe bleeding. In case of hemorrhagic shock and an IV line is available, you will secure venous access. You will treat for shock by raising the patient's extremities above the level of their head to allow blood to drain to the vital centers in the brain. You will then give IV fluids, and if an IV line is not available, you will give fluids rectally. Finally, you'll cover the girl or woman to keep her warm. If the girl or woman is having difficulty breathing, you will administer oxygen and always have a resuscitation tray nearby. You assess the severity of shock by checking and recording vital signs every 15 minutes. A note on referral: if you're seeing a patient with severe bleeding at a health facility where blood transfusion is not available, you will transfer her to a tertiary care health facility immediately where possible. The next immediate and or short-term health complication related to FGM is infection and septicemia. Infection may occur when FGM is conducted, as is typically the case, in unhygienic surroundings and with dirty instruments, and also if there is lack of proper wound care following the procedure. Management of infection and septicemia is the same as when these conditions result from other cases. First, you measure and record the patient's temperature, assessing the progress during treatment. You inspect the vulva carefully for signs of an infected wound, and then check for anything that may be contributing to the infection, such as obstruction of urine. If you suspect septicemia, you take a blood culture before starting IV antibiotic treatment. You can also take a vaginal swab or swab from the infected wound and a urine sample to test for the presence of infection and to identify the organisms involved. Any urinary obstruction should be released and the patient treated with antibiotics and analgesics. And if the wound is infected, it should be cleaned regularly with antiseptic. Apply a sterile gauze dressing and advise the girl or woman to keep it dry. Another immediate or short-term health complication of FGM is genital tissue swelling. This usually results from cutting and damaging of the genital tissues, resulting in local inflammatory response. Genital swelling may also be caused by an acute local infection. First, you carry out an assessment to determine the cause of the swelling. Then you inspect the vulva carefully for signs of an infected wound and check for anything else that may be contributing to the infection. If you diagnose an inflammatory response to the cutting, you give anti-inflammatory agents intravenously if possible and treat the site of the injury. And if the patient is unable to pass urine, you install a Foley's catheter to release the obstruction. The final short-term or immediate health complication of FGM is acute urine retention. This may be a result of injury, pain and fear of passing urine, or occlusion of the urethra as a result of infibulation. Acute urinary retention usually occurs due to genital tissue swelling and inflammation around the wound. First, you carry out an assessment to determine the cause of the urine retention, and if you suspect that the woman is unable to pass urine as a result of pain and fear, you should use appropriate nursing skills and techniques to encourage them, such as turning on a water tap and letting it run. If she's still unable to pass urine because of pain or fear, you'll then give her a strong analgesic with personal encouragement and support. If the woman is still unable to pass urine, you will install a Foley's catheter and leave it in place for 2 to 3 days. If her inability to pass urine is as a result of infibulation, You can open up the infibulation after counseling the patient and or their family member and obtaining their consent in a process called de-infibulation. If urine retention is due to injury to the opening of the urethra, you will refer the patient for surgical intervention. In summary, the short-term and immediate health complications related to FGM include severe pain and injury to tissue, hemorrhage and hemorrhagic shock, infection and septicemia, genital tissue swelling, and acute urine retention. These are typically managed in the same way as complications from other medical circumstances. Of note is that most patients who present with immediate and short-term health complications arising from FGM must be treated or referred without delay, especially those with life-threatening complications such as severe hemorrhage, hemorrhagic shock, and or septicemia. Thank you very much for listening in on this session on immediate and short-term complications related to FGM. Here are additional references for your further reading. Thank you.